A lot of you may know this, but here are some of the things that we want to pay attention to when it comes to our mental health. Confused thinking. Okay, now can I make put a pin in it, ladies? Sometimes this can happen on a monthly basis. I'm just saying that, okay? All right. Growing inability to cope with daily problems and activities. This is a big one, right? For some of the people that I know, the ability to get up and brush their teeth is hard. Make a meal, okay? Walk the dog. Prolonged depression, we know that feelings, we can't always be riding high. So, the roller coasters are normal, but we're talking about prolonged, and we're going to look at that in a couple minutes. Right? Prolonged. Thank you. Not prolonged. Prolonged. Thank you. Excessive fears, worries, and anxieties. Now, folks, some of this is normal, right? A lot of this stuff up here can be seen as normal. Fear, worry, and anxiety. These are normal everyday things, okay? Worry and fear make me go to work in the morning. I got to pay my mortgage, okay? So some things are acceptable. It's when it's excessive. Like, I don't like snakes or worms, but it's not going to prevent me from going to work because I don't work with snakes and worms. Do you understand what I'm saying? It becomes a challenge when, if I decide, or if I was in a car accident on the Gardner, and now I can't even get out of bed to go to work because I need to take the Gardner. So I started avoiding it. Now it's getting worse. So when it's stopping us, interfering with our daily activities. Emotional dysregulation, okay? Highs, lows, you're all over the place. Withdrawal and isolation. Denial of obvious problems. Let me put a pin in it here, because sometimes when I'm speaking with family members, they're like, Colleen, they don't believe there's something wrong with them. They don't believe. Okay. They tell me, oh my goodness, they are being, what do they say? They're in denial. Or what's the other word they use? There's another word.
Transference?
No, they are, well, it's almost like they're blaming them, saying they're refusing. They're in denial, but I'll think about it in a minute. But what I want to say about this place of denial, what we have to understand, sometimes people struggling with mental health, they lack what we call insight. Now, they've done a whole lot of work here about the front cortex of the brain. Much like when people are in a car accident, or maybe they've had a stroke, there's a part of the brain that is no longer recognizing that there's something wrong. How they discovered this lack of insight as a concerned with mental health, concerned with the brain, is that there was a psychiatrist who was working with a patient who was with his wife. The two of them were sitting side by side, and the patient was getting ready to go, or whatever, was upset, that whole denial thing, is getting ready to leave the office, went to take up his hat and coat, and was like pulling on his wife's head as if that was his hat. And so when they brought it to his attention, saying, look at, it's not a hat, it's your wife. And instead of him saying, oh my goodness, I'm so sorry, he was like, you moved my hat. There's a part of the brain that lacks the ability to see clearly anymore. So it's not that they're in denial, it's that they lack insight. They cannot see that there is something wrong. This is the same thing when we talk about stroke patients, or patients who've had an arm or leg or part of the body amputated. It's a phantom. The brain is so powerful that it'll actually cancel out things. And so I'm not a brainatologist.
A brainatologist.
I made that one.
Oh, good, because I was worried that I didn't understand what that meant. Okay.
But you have to understand that. And I love to tell families this. It's not that they're in denial and they don't care and they refuse to take their medication. Listen, If I don't believe I'm sick, why am I taking medication? Why would I take medication? Right? Let's go back on this medication piece because I don't work for big pharma, you know, but I find this balance, and I can freely say that medication has all at times conflicted with my faith. But here's the thing about medication: the clients that I work with, they don't use medications for the same reason that any one of us in this room wouldn't use medication. I have ear infections. I used to have chronic ear infections. I go to my doctor. She looks in. Oh, yeah, you've got to, Colleen, take these antibiotics. She gives me the prescription. And before I leave, she says, I want you to take all 7 days, even if you start feeling better, right? She always says that. So what happens? Day 1, woo, day 2. But day 3, I start feeling better. I'm like, who needs medication? It's the same thing with people who are struggling.
Yeah.
I take the medication, it controls my voices, it lifts up my spirit, I start feeling better. I say to myself, well, I don't need medication. You see the cycle? Okay. So it's not that they're trying to make your life miserable. They're just like you and me. Okay. Unexplained or numerous unexplained physical ailments. I can't tell you how many of my clients and the dentists are like best friends, or the doctors. I've got phantom pain here, or I've got, fibromyalgia, diabetes, okay, irritable bowel syndromes, migraines. All of these things are connected to how we are feeling in the mind. Because the brain, it's mind, body, and spirit, okay? The brain, if it cannot get any relief, it'll push out what it's feeling, and it will manifest itself into the physical body. So pay attention to that. Delusions or hallucinations, where you see, touch, hear, smell, or taste things that may not be there. And then, of course, suicide has been brought into the room. We know that suicidal thoughts and behaviors can happen as well. Mind you, some medication can also cause a lot of, right? I love the clinician who can just echo what I'm saying. A lot of the medications that we're taking, mental health medications, psychotropic medications aside, even other medications can confuse your thinking, can cause you depression, right? Can give you other ailments, okay? This is why I tell people, you've got to know who you are and know your body. Because what will heal me might kill you. I'm a faith believer. Can we bring that in the room? We lay hands and we say, be healed. Whatever, God may choose to heal you that way miraculously. And for some other people, he may choose to heal you with medications. So I can't take what you've, sorry, I'm looking at you just because you're there. I can't take what you've used and prescribe that to myself. The doctor in the room, you know, different patients react differently to different things because we're made up so differently. So think about that when you're dealing with people.